Former Chief Medical Officer Dr. Patrick Martin, while commending the St. Kitts Nevis health authorities for its COVID-19 response, believes there is room for improvement, especially as it relates to crisis risk management communications. Dr. Martin was speaking on Tuesday's edition of Let's Talk St. Kitts and Nevis on Voice of the Caribbean Radio.
There are areas for improvement, and one of those areas is crisis and emergency risk communication in terms of clear and accurate information in real time. I think our people deserve improvement in that regard. Be right, be clear, be truthful, be respectful, be empathetic, be honest, give people information, let them decide.
Based on the current statistics of COVID-19 cases from the Ministry of Health, there are 11 confirmed cases of coronavirus in St. Kitts and Nevis. The authorities are denying that there are cases of community or local transmission. Dr. Martin disagrees. He argues that based on the definition of local transmission from the World Health Organization, St. Kitts and Nevis has 3 cases of local transmission.
The terms community and transmission and local transmission have been used interchangeably, and they should not be. Community transmission means that cases are occurring and the authorities are blind. They don't know the sources and they don't know contacts. That's community transmission. Local transmission means that the source of the infection and the newly confirmed case are in the same place or in country or in the same community, the same locale. So that's local transmission. And as you said, imported is self-explanatory. So going from the WHO definitions, which are also echoed by CARPHA, we have 8 imported cases and 3 local transmission.
Meanwhile, Dr. Martin believes the government should have announced a minimum 2 weeks lockdown instead of the 1 week announced last week.
A lockdown is a measure as part of it's a virus suppression. You want to try to interrupt the spread of virus from an infector to infectee. Bearing in mind that this coronavirus, one person can infect up to 3. So suppression is designed to put as much distance as is feasible or possible between infectors, persons with the virus, and the rest of us. Since the virus has an incubation period of 14 days between time of exposure and time of symptoms, and since it has been documented that persons can spread the virus before, up to 2 days also before symptoms, a 14-day lockdown is indicated.
The former CMO commended the people of the country for their response to the measures issued by the government. Andre Huey, SKN Newsline.